Hi everyone, my name is Dannica Tometich. I'm a medical esthetician here at Coachlight. We're so excited to have you here today for our virtual event where we will go over all things laser. We'll go over picking the best one for you, what they're all about, and what to expect. You'll want to stay till the end for our live Q&A, our event-only specials, and our giveaway. A common question that my patients ask me this time of year is how do I address that summer sunspot hyperpigmentation, those very small freckles that start to come up after we've been exposed to a lot of heat. Our most popular and less invasive treatment is called BBL. BBL stands for broadband light. So the best reference I can think of to help explain it is that it's kind of like a really bright flashlight to the skin. So that handpiece is giving these warm pulses of light, and we get to use filters to help target certain discolorations and help guide where we want that light to go. So we have a filter for brown spots, we have a filter for redness, and then we also really love to use it to help with overall dullness in the skin and a little bit of skin tightening as well. It helps by this thermal injury into the skin that makes your skin cells act more youthful. So they over time are going to become more plump. They're going to be working the way that they are supposed to work. And that's what overall gets that healthy skin started for skin rejuvenation. But then you're also getting the color correction. So you get a little bit of best of both worlds with BBL. We often also use it as maintenance coming off of our more invasive laser procedures. A good candidate for BBL would be someone who has been out of the sun for several weeks, no sunless tanner, and it tends to be targeted towards our lighter skin tones as well. We do cap out. There is, certain Fitzpatricks that are going to be better candidates for other modalities. When we are concerned with redness and broken capillaries, we also can use laser to help correct that. Depending on what the redness or broken capillaries look like, we typically do start with BBL laser. BBL is going to help kind of constrict those vessels or even cauterize them so they're less visible at the surface. And then it can also help with just the overall inflammation of the skin and helping your barrier kind of re-strengthen itself. Sometimes with certain redness, when it comes to like post-inflammatory hyperpigmentation or breakout marks, we also use BBL, but then we might move on to another laser modality to get a more effective result. How would you address uneven skin tone, texture, and overall skin dullness? When we come in with those kinds of concerns, we will often move on to a laser called MOXI. MOXI is a non-ablative fractional laser, which means that laser will have a little bit easier downtime. This laser is going to help break through hyperpigmentation and kind of give us a really nice peeling effect. So that's where it will help with that overall glow, texture reduction, just evening things out overall with minimal downtime. With MOXI, we typically have 24 to 48 hours of what we call downtime. We also require that you avoid makeup and sweating during those periods. You will then have like a week of dryness. That dryness is what is called a mend on the skin, or they're kind of like microscopic scabs. They slough off very easily, but it does take about a week for those to fully go away. With downtime again, though, we're looking at the first like 2, sometimes 3 days, depending on how quickly your skin bounces back of downtime. When we have more advanced concerns, we would then go on to a laser called Halo. Halo is a hybrid fractionated laser, which means it has 2 different little red beam lasers that are going to hit the skin at different levels and target different concerns. It's still very customizable based off of your skin tone, what we're trying to target, and how deep we need to go. Concerns that are best suited for Halo would be certain levels of melasma, very deep or large brown spots, especially the brown spots that start to get some texture to them. We need something a little bit more powerful to break those up. And then a patient who's also concerned with like skin laxity, crepiness, any deeper issues that a MOXI can't handle. What can you expect with downtime with Halo? You can definitely expect a little bit more downtime, but it is worth it. You will have about 4 to 5 days of no makeup, no sweating. A lot of our side effects will build to day 3. So your redness will hold strong for 3 days. Your swelling can sometimes build up to 3 days. Things just kind of stay put for those first few days, and then you'll turn a quick corner and things will get better. It's about 7 to 10 days until your skin is completely back to normal and you'll be feeling confident again. We do have some new add-ons that we can help speed up your recovery, but it's always best to just be prepared for the worst and hope that it goes much more smoothly for you. Thank you so much for attending our virtual event. We're going to move on to our live Q&A. Make sure you stay until the end for our events only specials and our giveaway.
All right. Hey guys, it's me, Lauren, and I've got our star of the show here, Dannica, with us today. Thanks for joining our virtual event. Dannica, hello.
Hi.
Yes. I'm excited to have you guys all on. There's a lot of people who have registered, so I want to do some quick housekeeping before we go to our live Q&A. I see a lot of people have already put in questions in the chat, so feel free to submit your questions regarding all things laser. So BBL, MOXI, Halo are our top 3 laser treatments that we offer, but feel free to ask more questions about all the modalities and skincare that we offer here at Coachlight. So little housekeeping things first regarding for our giveaway eligibility. For example, you have to stay till the end of the virtual event. I can see you. I can see how many people are registered for this event and then how long you stay till you can see how long people have stayed till the end of the show, so to speak. I will try and do, just to keep mindful of people's time, we'll try and do this seminar till about 12:30 is when we'll stop, but we can still respond to your questions in the chat and reach out to you regarding any questions that you have about our treatments or the offers. Now, during this presentation as well, this live Q&A, you're going to be sent like an opt-in to get sent these event only specials. You have to reply to that in order to be sent the link, because we're having these offers for our lasers. You're able to purchase them online. And so I want to coach on that a little bit, because we do only have a limited amount of these offers that are available for purchase online. And if you don't know which laser treatment to pick, that's fine, but you will need to schedule a laser skincare consultation with us by Friday, October 17th, and we will honor that event only special if you don't know which treatment offer to work with. And then the only other thing too is members. So Coachlight members, you might be asking, well, hey, can I use some of my beauty bank balance on these treatment offers? Yes, you can. You will need to call so we can do that transaction over the phone. You can't use your beauty bank balance on these offers that are available for purchase online. Okay. Okay, so I needed to get all that out first, and we'll coach on that again. But Dannica, let's get started.
Okay.
It is laser season.
It is laser season. Thank goodness.
Thank goodness. Yes.
Patiently waiting.
Yes. And so let's talk about laser season, right? What makes that even? Oh, so people, if you're getting the contact me for a consult and those offers, you can opt in for that now. Okay, so laser season, Dannica, when I think about that and I see some questions on here already, tell me about why is it laser season? Is it always laser season, or what is that?
I mean, it can always be laser season. I think it really just depends on your lifestyle and, are we in a maintenance phase, or are we starting, fresh from square one? And I think it, just depends on your day-to-day life. So like, Sciton specifically is made in California. They have these lasers all over the country, all over the world, in very, very sunny places. And so I think it's just deciding, you and your provider, what is best for you and what is your concern. If we're treating pigment, sometimes we might wait to treat pigment until this time of year. But if we're focused on texture and pore size and things like that, and we don't have pigmented issues, we can really do these lasers anytime. It's going to be, that week prior to you coming in and while you're healing that you need to be the most cautious, which we should be wearing our sunscreen every day, and we should be taking those normal precautions for anti-aging. And it also just depends on the areas that you're treating too. So I see such good questions, you guys. I'm really proud of you guys for asking these too.
Yes, good stuff. Okay, well then can you speak on there's the three main lasers, BBL, MOXI, and Halo. Can you talk about like downtime of each and expectations?
Yeah, so BBL, typically when we are doing BBL by itself, there's no specific downtime. Like you can usually wear makeup right away. If we're treating redness in the skin, again, provider preference, but sometimes we'll have you avoid like super vigorous workouts afterwards, anything that would like flush your skin, make your cheeks red. So alcohol, spicy foods, things like that, just going to help you get a quicker outcome and help you maintain a little bit longer. So no specific downtime with that guy. When we do something like MOXI does have 24 to 48 hours of downtime. So downtime is that no makeup, no sweating. People are going to know that you did something. So it's still pretty easy to manage. There is still about, a week of dryness with MOXI, but it's just less noticeable overall, and you can wear makeup at that point. With Halo, we're typically going to talk about, 5 days, no sweating, no makeup. And your side effects of Halo are going to be pretty intense, pretty noticeable those first 4 to 5 days as well.
Okay. Well, don't we have like things that you can use? We have like a PDGF, right? That you can use to like help with that downtime of like
Absolutely. So PDGF is a platelet-derived growth factor. So it's a lab-created growth factor. You can kind of think of it like a fertilizer or Gatorade for your collagen and elastin. But we have been using that topically post-treatment on our ablative especially, but you could also do it on MOXI, you could do it on microneedling to really speed up your recovery and try to help lessen that inflammatory response with the swelling. So it has been really, really great so far. So that is something that you could add on to help, especially if we're trying to squeeze anything in, before an event, or if you, for example, took off work on a Friday, you want to be able to go back to work on Monday feeling pretty confident. Something like PDGF or even PRF, platelet-rich fibrinogen, would be a great option to add topically to try to speed things up a little.
Nice. And your provider will make that recommendation
Absolutely.
based on kind of, what your goals are.
Yeah.
I love the melasma management question. What laser is best for melasma, or how do you decide what to do?
So in deciding with melasma, it really depends on the kind of melasma that we have. Does it blanch when we touch it? Is it epidermal or dermal are the big questions. So a lot of times a very safe bet is treating with MOXI, but depending again on what other concerns we have and how your skin is and your skin tone and type, Halo would be an option too. But I would definitely say since MOXI came around, she's our go-to girl for helping treat melasma.
Why do you recommend like MOXI over Halo for someone? Like what's the difference?
It definitely depends on how much melanin is in our skin, so how dark our skin tone is. If we're adding too much injury or too much inflammation, it can definitely trigger melasma. So, you and your provider are going to decide on like a pre-treatment plan if we need one. And then you're really going to talk about pigment correctors post-treatment to try to lessen that risk of having a rebound production of those dark melanocytes. So again, it's all going to be a provider customized treatment plan for you. And they are going to do, we all have a different route of getting to our end goal, but for the most part with melasma, we're kind of on the same team. So, pigment correctors are going to help. MOXI is just a little less inflammatory since it's non-ablative. It's not breaking through the skin, which can typically be better for melasma. It's just a really stubborn, tricky pigment.
What about if I don't have melasma and I've done a MOXI or I've done a Halo, or like, why would I like choose or How do you recommend
Yeah,
that?
yeah. So typically with MOXI, it can be used for maintenance if you are a patient who's done Halo before, but we don't quite need that again, or you don't have the downtime for Halo. But for the most part, MOXI is a really, really great treatment for pigmented issues. So it's helping treat like different levels of brown that BBL can't quite reach. BBL is really only able to color correct what's visible to the naked eye. So very, very surface. So that MOXI, that little red beam laser is going to break through that, go past that. So just, textured spots, like if we start to get a brown rough spot or even actinic keratoses, those can be like kind of red textured spots. That little red beam laser is going to help break through those and kind of give us a really nice polishing. MOXI can definitely help with texture, but if we are worried about crepiness or pore size, deeper wrinkles, we need to go deeper. So that's where we would then choose to move on to Halo. We love Halo. We don't want to have to do her all the time because it is a little bit of a more rough recovery. So that's where MOXI still can come into play for maintenance. BBL can still come into play for maintenance. I think it just depends on how big you want to go, your age bracket, what's the state of our skin to begin with.
Mm-hmm. I love that.
Yeah.
How often then should I get a MOXI or a Halo or BBL or all of them?
Okay.
I say get all of them.
Big picture, like perfect world scenario, you're doing something quarterly to your skin, some kind of purposeful injury. So, that could be a BBL. I know we're not on the microneedling talk right now, but that could be a microneedling. It could be a Halo. Typically Halo, is recommended as like an annual treatment. Again, depends on the focus. But MOXI is definitely like a once or twice a year. Melasma is a different beast. We might do that 3 times a year. I think it just depends on what you're doing at home. And what products are we feeding our skin at home? You then sometimes get to see us less. You don't need me quite as much. Skincare is the basis of all. That's going to help you get the most out of your treatments and help you maintain that result for sure.
Nice. Yes. And during like our consultations, laser consultation and our skincare Visia consultation, your provider can give you kind of like the year plan.
Absolutely.
And and like your at-home care too is super, super important, and they're fun and free.
The skincare is the most important part. I love lasers, and that is what I'm here to do, is to treat you. But we all want to set you up for success. And if you had to pick, I'm typically going to go for that skincare. It is very much like the gym and diet. If we don't have the diet and nutrition down, those treatments aren't completely moot, but you're not going to get everything that you want out of that investment.
Yes. The day-to-day.
The day-to-day is so important.
Yes. What laser would work best with the appearance of large pores?
Large pores, I would, without seeing you, I would probably just go for Halo. You would probably need to do several MOXIs to get a somewhat similar result to a Halo treatment. So if pores are our concern, I would just go for the Halo.
Okay.
Yeah.
And then like for BBL, we combine that with MOXI and Halo. Why do we do that? Or is that beneficial?
Yeah. So BBL is so great. So like if you are coming in and your concern is pores, but I also have some vascularity, I have some redness. Well, that BBL is again searching for color. So she's going to see those surface reds and browns, but that would be really great for treating the redness. And then we'd go right over top of that with that Halo. If we are treating like brown spots, overall, again, that BBL is really great tool to kind of pull some things to the surface. And then that red beam laser, so your Halo or your MOXI is going to then blast through it. So they really are the perfect power couple. I would say our most popular reason for why we would stack BBL is definitely like the redness. It's very straightforward, and being able to see that and treat those vessels, broken capillaries around the nose, the cheeks. But it just is like the perfect insurance policy of making sure that we're cleaning up all the different layers of concerns.
Nice.
Yeah.
Interesting. Can you get Botox at the same appointment with a laser treatment, Botox or Dysport?
Yeah. I think definitely like provider discretion. I would say for sure with BBL, like absolutely no problems. You would want to always do your skin treatment first, and then we would pass you off to your nurse injector. MOXI we could do. I would definitely say not for a first timer. I wouldn't risk it, but it's, if you've done MOXI or the Botox injections before, you kind of know what your response is. So you would know then if something not great was happening. With Halo, I would say best to avoid. When we do an injection and then we have something that's a kind of inflammatory, you could move some things around just because of the swelling factor. So, best practice would be to separate them. But if you're out of town or something, we will always try to do our best to accommodate you. Just know that, there's a little room for error there. So again, we want a little perfection. So separating those would most likely be best.
And in theory, I like for if it's a Halo scenario too, it's just wait till you have your downtime completed, then you can kind of more enjoy the results of the injectable longer than maybe losing a week of it.
Yeah. And I like to tell my consults too, if you're coming from square one and you're like, okay, I want the best, the quickest result and the best. I would love for you to do your Botox or Dysport, let that kick in, come in 2 weeks later, do your laser. Right as that neuromodulator is relaxing some of those expression lines, you're getting that collagen production from our treatment. There's no right or wrong order, but I think it's such a great result. And while that neuromodulator is working, you're seeing those lines soften. It just gives you a little bit of instant gratification while you wait for that extra collagen production to actually kick in. So again, stacking is our favorite, and I love to do it in that order.
Good. What kind of BBL do we offer? Ooh, somebody knows their stuff.
Right. So there's lots of different BBLs, and I just always say it's kind of like the new iPhone version of things. So we still have traditional Forever Young BBL, the OG. We're doing that less and less as we have brought on BBL Hero. There is the newest on the market, BBL Heroic, which is a very cool GPS technology. I'm sure we'll add that to our toolbox at some point. BBL Hero and Heroic are still that same high energy, rapid output. And so we have been offering that. There's lots of different filters that we get to use. So that helps with the wavelength and what the BBL is targeting, what it's looking for. So with BBL Hero, we're going through doing our normal we call it an anti-aging pass, but it's really just heating up your pigmented issues. Again, even for maintenance, it's just sending light into the skin, helping stimulate that collagen and elastin. We'll go through and do our color correction. So that's where we'll go and zap, individual concerns. So brown spots or redness in the skin. And then we end with what we call this photo filter pass. So it's kind of the nice and tight. It's a little lifting and firming. And I also feel like it really helps kind of calm any inflammation that we caused from the spot treatment. So there's lots of different layers to BBL Hero, which is really great. Comparing BBL Hero to what we used to do with Forever Young. Forever Young, you used to get about 300 to 350 flashes of light into the skin. And with Hero, we're getting about 1,200 on average. And so that's four times as much. So it's just so much more stimulating, and it is more firming. You're getting a lot more anti-aging out of it.
What about the BBL? Somebody's asking about BBL, not just on your face, your neck, body,
head to toe.
Head to toe.
Head to toe.
Okay. So, why would I do that?
Yeah, I would say face, neck, chest, and the backs of our hands are definitely super popular. But you're a bride, you're getting ready for a wedding, you have a backless dress, we can treat your back, your shoulders. I've treated lots of legs and shins. We can treat anywhere. I've treated intimate areas, we can do it all. We also kind of stack it. I see a question about lasers for tummy tuck scars. We can sometimes then stack BBL for that pink purple tone on a scar. And then if it's raised or there's some texture to it, we might go ahead and do something like MOXI or Halo over it. Just depends on what your scar looks like, and we'll pick that for you. But it's really great for pulling out kind of the pink tone and then going back in and helping reduce that scar tissue with Halo usually. Okay. So it's really great. All of our lasers, you guys, are head to toe. So we've treated men on the tops of their heads. MOXI is great in the hairline. It can help stimulate blood flow for hair growth sometimes. Other things out there, but we can do it. So all of our lasers are great for that.
Yeah. What about, can you treat like the creepy skin on the neck?
Yeah. So creepiness, usually we just need a little bit of a deeper injury. So again, halo would most likely be best. But then sometimes too, we have soft wave as well.
Mhm.
So it just depends on what that creepiness looks like. But in the laser family, halo would be really, really great for the creepiness on the neck.
Would that be like your favorite if we're doing neck scenario and I've got creepy skin?
Yeah, I would definitely say so. MOXI is great for like kind of a polishing, so it can help with the fine lines, but that creepiness, we want to like really plump and thicken that skin a little bit. So I'd probably start with a halo, and then we might have you then maintain with like BBL Hero just to get some heat and keep that skin nice and plump.
Okay.
Yeah.
In your mid upper 30s, you've never done anything before.
Yeah.
You're new to the biz.
Mhm.
What would you recommend starting with?
I think it really depends on, what are you looking at? When you look in the mirror, are you starting to see some discolorations, or are you more on texture? And then we would decide from there. It does say, would you recommend starting with BBL? Depending on your skin tone, yeah. If you're a little nervous about it, for sure. That's such a great start. And you're never going to pick wrong by starting with a little bit less invasive treatment and stacking on a heavier duty one later. All of the treatments literally are going to stack on the collagen production. So again, that's what if you don't have a concern, I will make my recommendation, but I want to treat what you're seeing, and that's when we'll do our Visia and we'll pull that up together and chat. And sometimes too, if we don't come in with a specific item after doing something like the Visia, and it grades us and it lets us know maybe where we're lacking in certain categories of our skin health, we can kind of say, okay, the Visia analysis saw that we are really red and we have some pore size and texture. So let's start with BBL, but knowing that we need to move on to a MOXI or halo, depending on our age bracket.
Love it. You get them together. We have been calling, like, if you get the BBL MOXI and BBL halo together, it's like the BBL, or not
the MOXI Bright.
MOXI Bright,
yeah,
yes.
or the Halo Bright.
Oh,
So
they're so good.
They're the perfect power couple. You can't go wrong.
Yes.
Yeah.
Worried about the pain. Can we talk about that? LOL.
Yes.
That is a question and a statement, and you'll be fine.
Okay, so beauty's pain, right? Have we heard that before? Right, maybe a time or two. Topical numbing, we really have an amazing topical numbing cream. So it's kind of a mixture of 3 different canes. So lidocaine, benzocaine, tetracaine, really great. Yes, it's spicy in the moment, but really the amount of time that the laser's on your skin is super minimal. So we have lots of tools to keep you comfortable and calm during your treatment. You're gonna get through the laser treatment just fine. BBL, really no lingering discomfort. While it's in the moment, I actually do feel like it's better if you don't numb for that one when you're doing it by itself. It's just easy. We use what's called a Zimmer wand. So it's kind of this very high powered machine that just blasts you with cold air during the treatment. So it's kind of like an ice pack without anything touching your skin. You can literally give childbirth with that thing and like be great. It's so good. So you'll have that. At BBL, again, short-lived, just in the moment. It's a little spicy. It's the bright light that kind of makes you nervous with that one, not necessarily pain. When we move on to MOXI, MOXI is very slow to go in the heat building. So that device, we are rolling across the skin and it's kind of scattering out those red dots like a sparkler. The more passes we do, that heat slowly builds. Again, you're going to get through the treatment with flying colors. It's so easy. Afterwards, you're hot. You've got an hour window with MOXI where you have maybe just a little moment of like, what did I do? Goes away very quickly. Again, like a light switch shuts off at the hour mark and you're like, okay, we're fine. Normal sunburn at that point. With Halo, very similar. Same thing. It's not going to be this snap of heat, but as we roll that handpiece along the skin, that heat is building. You're going to have a good wall of heat for about 2 hours with Halo. So in my opinion, I think that's kind of the worst part. Just keep yourself busy and distracted and upright, and you're going to drive home and have the AC on blasting on your face, even in the dead of winter. You're going to get through it. With all of those treatments, and the way that they injure the skin or ablate the skin. It's pretty minimal with our skincare that we send home with you. You're not going to continue to feel like burning when you do your skincare. You're not going to have that anxiety of like, I have to wash my face and this is going to hurt so bad. It's so easy. So it's really that window of heat afterwards that I think makes people nervous. We retail a thermal spray, water spray that keeps you comfortable. Again, a fan is really great. You're going to do wonderful. You'll be just fine. And it's so worth it when you see that fresh skin. You'll start to see changes, within a week, and it's awesome. It's worth it.
Yes. And it's like, for my first experience, when people are doing it for laser for the first time, that's probably just like the only time where, it's like you need to experience it to realize that it's not that bad. And yes, it's equivalent to a sunburn scenario sensation.
Yeah.
And since you've never experienced it in that way, you're like, oh, is it going to keep getting hotter? And it doesn't.
No.
It taps out, like she's saying, within a 2-hour time frame.
Yeah.
And then goes away. But you just kind of have to experience it, but you'll be fine. We do this every day, all the time. People leave and check out.
And you come back.
And you come back and
back.
Please more is the result. That's so fun and exciting for people.
Yeah.
What about this? Well, how would you compare BBL to IPL? Can you help me understand that?
So similar families, I would say BBL is just, again, like that new iPhone version. It's the best iPhone version of intense pulse light. So they are both light-based treatment devices. BBL, we can get a lot more pulses of light into the skin because of the different filters that we get to use. So almost like a Snapchat filter, we get to slide this filter into that light to determine what it's looking for, what color overall. And so IPL is a little bit more, I would say a little bit more one size fits all. With BBL, we can really, really customize what we're trying to treat. A little bit safer on the aspect of the different filters. We have better cooling mechanisms. It can be more comfortable. But all in all, just getting as many pulses of light into the skin gets you so much more anti-aging.
And BBL is like the branded Cyton.
Correct.
IPL too. And IPL is more like general based, where we only carry the Cyton branded, which is, by the way, guys, if you are doing any sort of laser treatments, you only want to have the Cytons.
Cyton is by far the best.
Yeah. They
just have the best education. They're made in the United States, which is awesome. That also just helps us with fixing machines, and not that they need fixed very often because they're super amazing, but the education is key, and they're constantly helping us learn and improve our techniques. And that's what makes us such a great practice, is having Cyton, but Cyton is the best of the best.
The gold standard.
Correct.
For sure.
Yeah.
Don't work with a practice or provider who's not carrying them. Would be my advice.
Yeah.
Okay, let's do 2 more because we're already past 12:30. Good stuff. Okay. How long does the appointment last for a standard face and neck scenario?
Yeah. So your BBL, I think, again, it would just depend on if you're wanting to numb or not from that one. If you're very nervous, go ahead and numb. But usually BBL is probably about 40 minutes for face and neck. With your MOXI and Halo, MOXI, you want a minimum of 30 minutes of numbing. And then the laser procedure would probably be scheduled for about an hour. For Halo, we're looking at more like 40 minutes to an hour of numbing. And then again, typically treating, face and neck at like an hour appointment time. So, Halo, maybe about 2 hours of time tops. Your MOXI would be about an hour and a half. And then let's just give you extra time with your BBL. Let's just say an hour for your BBL.
Great.
Yes.
I'm going to do 1 more, guys, and then we can still answer these questions in the chat and text you directly on them. So don't think that you're not going to be reached out to. And then as a reminder too, we are going to select the giveaway winner after this virtual event, and I can see who all has completed the virtual event. So stay on for a couple more minutes. Let's do 1 more here, Dannica. Oh, okay. So look, here we go. Look, how do I know which one is best? I wanted to try any of them, but don't know which one to book.
All you have to do is come in for a consult. It's a complimentary consultation. I promise it is so worth your time. That will just set you up for the best success. We want to pick what is right for you, and you have time, even with these event-only promos, to figure that out. If you purchase one that's not right for you, we will help you correct that. But we are here to help listen to your concerns and pick what's best for you. So it's all in a consult.
Right. And that doesn't necessarily mean the laser, like Dannica was saying. You might be like a way better candidate for microneedling.
Yeah, or soft
in
waves
yours.
if we're worried about laxity. So we'll pick that for you. We'll help that, decision.
Right. So it was worth your time. So
Definitely.
as a reminder, you guys are going to receive a text regarding the opt-in for like either a consultation. You'll be sent the link for the event only offers. And I will say this, like we have like over 200 people who have registered on this event. The way that you can purchase these offers online too, there's only 50 available total. So like they will sell out is what I'm trying to say. So if you know that you want that event only special, you're going to be saving 30 to 40% depending on the offer. And we have offers available for MOXI Bright, Halo Bright, and then BBL, MOXI, and Halo. 5 things. Okay. 5 things, 50 total for all those scenarios, and they will go fast. But we're here to help, and reach out if you guys have questions. We'll continue to answer questions in the tab here. And Dannica, you're amazing.
Oh, thank you.
Yes. So
thank you guys for joining us.
yes, thank you guys. Have a good one.